Epilepsy belongs to the group of the neurological disorders in which there is an period of seizural disorder, which is also prescribed or which is also diagnosed as to be having an abnormal behavior, loss of awareness, or having the abnormal sensations by the person. So what happens during a seizure? There are these characteristic seizures. They can be these seizures which are characterized by the generalized tonic-clonic seizures. Then we can have the partial seizures. We can have the complex partial seizures. We can have the petit mal epilepsies as well, in which the person has the absence seizures. So these are the range of seizures that are basically experienced by the individual who is having an epileptic attack or who is basically suffering from the disease which is known as an epileptic seizure or epilepsy. So over here in this section, we'll be just concentrating on the diagnosis of the epilepsy. How do they basically clinically present in an outpatient department? You come across a patient who is having a generalized tonic-clonic seizure. What happens during the seizural attack? There is an impulsive activity, there is an increased electrical activity or brain impulses during the seizural attack. So they can even be recorded on the EEGs, that is the electroencephalograms, if they are carried out during the seizure when it is currently happening to the person. Then how do we basically differentiate between the post-concussion syndrome, which has some sort of similar signs and symptoms that are quite related to the epilepsy? And then how do we basically go about and define epilepsy, or the clinical presentation of the epilepsy is very important. What are the causative factors or the risk factors that are related to the epilepsy? That is again very important over here. So we'll be discussing all of this over here in this very second section. Post-concussion syndrome, it is characterized after the head injury, and it is characterized by anxiety and irritability. Usually the person complains of the lack of sleep or the chronic tiredness. These are the symptoms that are usually seen in these individuals. There is a reduced concentration or depression that is seen in these individuals, as well as we have the emotional lability. That is also observed in these individuals. And then we have the hypersensitivity to noise or light. So even these can be seen in the person who has the recent trauma to the head or the head injury, and after this concussion, he may go about and have all of these signs and symptoms. Hypersensitivity to light basically means if he or she is exposed to noise or light, he or she may develop a headache or severe headaches. And then the emotional lability is usually described as it can be the phases of mania, or it can be the phases of depression that are seen in these individuals. There is a reduced concentration, thought form and thought content of these individuals is also affected. So when we define epilepsy, it is basically a chronic neurological disorder which is characterized by recurring seizures that are not otherwise provoked by any acute injury or health emergency. So usually there is no history of trauma in these individuals. There is no history of any medical condition that aroused these electrical impulses to be the impulsified or amplified electrical impulses in the brain, causing the seizures in these epileptic individuals. So that is the history, and that is how do we basically define this epileptic conditions. 0.5 to 1% is the prevalence rate, excluding the inactive seizures, excluding the febrile convulsions or people having the single seizure in their life and seizures associated with increased body temperatures. More common in men. In most cases, the cause is unknown in these individuals. Now, when we say the cause is unknown, that means that further investigations were needed to be carried out, and the known causes, they include the cerebrovascular accidents or diseases, that is the CVAs. Then we can have the cerebral tumors, that is characterized by the focal lesions. We can have the alcohol-related seizures in these individuals, or the post-traumatic seizures. Even after after a history of a recent trauma, the patient can present with these seizural disorders in these individuals. The causes of epilepsy, they basically include the cerebral palsy, cognitive impairments. Then we have the ADHD, that is people suffering from the attention deficit hyperactivity syndromes. Even they can present to be having the epileptic seizures or the cognitive impairments. Then we have the developmental disabilities. Even the physical disabilities can manifest as epileptic individuals. Then we have the autism. So people suffering from the autistic spectral disorders are more prone to developing this epileptic disease in the future. Moving on to the causes of the seizures. So, what are the causative factors? We have to investigate the causative factors. We have to go about and investigate the risk factors that make the person more prone to the development of the disease, this disease which is known as the epilepsy. So, knowing the causative factors is again very important. The high fever, especially in the infants, can lead to the development of this condition, which is known as epilepsy. So, knowing the past medical, knowing the past surgical history, knowing the childhood history is again very important. When we go about and take the history in a patient who is suffering from the epileptic seizure in the emergency department, usually the collateral history is taken from the primary caregivers that are available at the spot. So the past surgical, the personal traits are obviously noted down, and then we go about and take the history of the presenting complaints, and as well as the past surgical and the medical history. The personal history is taken. The socioeconomic history is again very important in these patients who are suffering from epilepsy. Then we also go about and take the past medical conditions that the person has been suffering from. If there are any episodes of high fever, then that can make the person more prone to the development of epilepsy in these individuals. Now, the drug use and the alcohol withdrawal is again one of the causative factor over here that we have to note down, and we have to go about and deal with these personal habits or these personal history taking phenomena. That basically includes any drug abuse. It can range from even the nicotine, caffeine, tobacco, and as well as the alcohol, which can be the drugs of the misuse. Then we have the near drowning syndromes or the lack of oxygen from any other cause. So if the person has experienced any near drowning cases in his past, or any traumas that can cause the lack of oxygen supply to the brain, that can also affect the normal brain functioning in that individual and can lead or make the person more prone to the development of this seizural disorder. So then we have the metabolic disturbances, and we can also note down if the person is suffering from any sorts of metabolic disturbances, or he's having any sorts of history of suffering from any metabolic disturbances. Head trauma or injuries to the head are again also, they present as suffering from the seizures or suffering from epilepsy, or even the post-concussion syndrome is observed in people who have suffered from head trauma in their near past. Brain tumor, infections, and stroke. These are the histories or the important points in the history that have to be highlighted if the patient has suffered from them. And then we have the complications of the diabetes or pregnancy that can also come up with these kind of seizural disorders or epileptic disorders in these individuals. So basically in this section, we summarized the condition which is known as epilepsy. What is the definition of epilepsy and this condition, and what are the causative factors that make the person more prone to the development of this epileptic syndrome. So that is the end of this section. Thank you for watching sqadia.com.